Welcome to the AMMR. I'm excited to share with you the work of our parish ministries and their social outreaches. Our parish ministries for migrants and refugees are the primary channels through which our Catholic faithful serve and deliver aid to the immigrant community. They form the AMMR's core network of community groups mobilized by parish community volunteers who work selflessly to provide aid and support to migrants and refugees. Ministries are quite varied in their sizes, capacities, main focus areas, in the aid they provide, and in the degree to which assistance is given. All ministry outreaches include food aid, then begin to diverge where they assist with other needs such as accessing healthcare products and services, education, housing, clothing, employment, legal aid, documentation, counseling and mediation services, financial services, child protection, as well as those who carry out religious activities, social activities, community advocacy, and provide marketplace opportunities. I encourage everyone to volunteer with the AMMR through our parish ministries. Let's support the efforts of the Catholic Church in caring for migrants and refugees and working towards social justice for all within Trinidad and Tobago.
After seeing what was happening with migrants all around, we had a couple of persons who came forward who were involved with registering the migrants when they had this registration, state registration. And from their stories, we decided, we are going to take that chance and do it. We were feeling out, and then we had these Spanish masses. We started to have a Spanish mass in the parish church on a Sunday, and several people came up to us asking us about when are we going to have a class. Their children had no places to go, and basically I think that was our greatest motivation. These children, it was such a joy, when they come in the morning, each person had their own way of responding to you. They would hug you, they'd call you a teacher, they'd call you professor, they'd call you different little names, they each had their own way of greeting you, and it was a joy. At the beginning of pandemic, when we realized we had to stop and we said no more contact, it really was a different feeling. But we have taken up the offer from the AMMR for the education aspect of it. Our education person is working now with the person from AMMR to get all our children enrolled in their group in the meanwhile, until we could get back to physical space.
In 2018, migrants just showed up, I suppose because it's a church, chaplaincy, pastoral center. Migrants came, and Father Stephen and I discussed the situation, and because the pastoral center had some extra rooms, we accepted them. And then in 2018, our beloved Archbishop, Jason Gordon, made an appeal. I think it was on the 10th of May 2018. He made an appeal for churches to receive them and to reach out to them. And that message our Archbishop sent out to the public, it was also published in the Catholic News, confirmed that Father Stephen and I were on the right track and doing something for migrants. They have asked us to create a youth-friendly space. Firstly, he mentioned child-friendly space. But I thought that we should look a little bit at the young people, the teenagers, because we are dealing with university students. And I think university students can better minister to teenagers as opposed to very young children. So after discussion and careful planning with Matthew, who represents the AMMR, we thought, yes, because I do have a 17-year-old here, we thought that we should really reach out to that age group. I think I would need a clearer understanding and appreciation from society. Because we still have people who would say, oh, Sister, all you're helping them migrants, they just so wayward, some of them are stealing. You didn't hear some of them ended up in prison, and so I want to move beyond that. And when we look at even our Holy Scripture, to act justly, love tenderly, walk humbly with our God, from Micah 6:8, how could we turn our backs on these migrants?
When I came here, I came with a lot of will, dreams, and that's why I still believe in this land, and I still believe in the people that are here. And I found this on a very, very good opportunity to overcome, to develop a better society which has an impact with the migration process. The Legal Aid program, I think that it's taught as a goodwill intention, but it turns out to be more than a goodwill intention, because it's right focused to those main problems that a migrant process brings on, which is, respect for our rights, human rights, and that comes with medical and lawyers too, a very important side of those rights. Communication is key, but key to what? To be more together, to be in this together. So when we attach this kind of communication in a good way, I believe that Spanish building session builds that.
I was at home, and one day the owner of a pharmacy in my village called, and she said, Marian, there's a Venezuelan guy here. He works at a Chinese restaurant. He comes across, he buys a soft drink because he knows to sell drinks at the pharmacy. And he's trying to explain to me, apparently he needs help. He wants to leave where he's working, and I can't understand him. I know you speak Spanish, so can you come up and help? And I said, okay, I'll come up. So I went that day, and I realized he was having problems where he was working. He wanted to leave. He had not registered with the UNHCR, and he wanted to go to Living Waters. He didn't know how to go, and there started my journey. We need a doctor, they need a doctor. Unfortunately, medical care is not so forthcoming for them in Trinidad and Tobago, and I've seen that personally. On one occasion, there was a lady came to me. She was bleeding, not very heavily, but she was bleeding, and she couldn't understand what was going on because she had done some procedures in Venezuela, and she was saying, well, I shouldn't be bleeding. So I said, well, we will go to the hospital, but I'm not too sure, based on previous experiences, if they will attend to you. So I prayed about it, so we went to the AMMR Health Center. We got to triage. The nurse checked. She had her UNHCR card. She didn't have the other one. So we passed there. I said, okay, good. God answer our prayer. So we're going down to the clinic now so that the doctor could attend to her. So it was her turn, and we went in. The nurse called her to check her blood pressure, the sugar. Before you see the doctor, you do these things. And the nurse looked at me and she said, what you doing here? You know she shouldn't be here. Why did you bring her here? No, they are drain on our health care. No, she's not to be here at all. She cannot come back. You have to pay for her private test. But the lady is bleeding. She said she has to go privately. But God, she allowed her to go. I mean, the press did work. She allowed her to see the Cuban doctor who spoke Spanish, and he spoke to her, but we couldn't because she made it very clear that we couldn't go back. So that I helped her with some money to go and get other checks, and and basically that's it. Then there's the health fair. You see so many people. I was present at one in February in Arima. So many, they are so grateful. So grateful for the vaccines and the testing of just the simple blood pressure and all the different tests offered there. The shots, the influenza shots, the yellow fever shots, and they are so grateful.